But I wanted just to address a couple of questions to Mr. Morrison, because in June, when you were announcing the closure, you said the centre must close because the building is not suitable and cannot be brought to the standard needed and that you deserve. And you went on to say, as we started planning for a refurbishment, it also became clear the work would not be enough to bring the building to the standard quite rightly required by the Mental Health Commission. And then in a letter to the Taoiseach's office in July, you, Mr. Morrison, said, no matter what refurbishment takes place, the building will not meet either building standards or the high standards set by the Mental Health Commission. Now, you know, there's a strong impression been given here to residents and their families and to the public representatives that the Mental Health Commission's concerns played a large part in the closure decision. And also it's implied that other facilities are of a better standard. But yet, you know, some alternative facilities can involve dorm-style accommodation in ward-based settings. For example, St. Stephen's Hospital and St. Catherine's Ward. How do you reconcile those communications with the reality of those alternative placements where you're proposing to move people from what are essentially single, in some cases small rooms, to dorm-style accommodation in St. Stephen's and in St. Catherine's Ward?
Deputy, thank you very much for your question. I suppose we came into this from the perspective of looking to see whether we could refurbish the building, and I'll defer to my colleague in a second in relation to the details in relation to that. We did exercises, and we looked to see if we could refurbish the building, and subsequent.
Okay, I wonder, could Mr. Morrison just respond to those questions, please?
Sorry, which question would you like me to respond to first, Deputy Shortall? I was responding to the overall situation. The first question you asked.
Okay, I asked, how can you reconcile the comments that you made at the time to the fact that the proposal is that some of the residents would move to dorm-style accommodation in St. Stephen's and St. Catherine's Ward?
Well, firstly, Deputy, the current process in relation to the interaction with the families and the residents themselves would have resulted in I suppose 3 separate meetings at this stage with the multidisciplinary team, with the consultant psychiatrist involved, with the clinical director, and with the ECD. That consultation process is based on 2 things. It's based on the assessed needs of the individual, and it's based... Sorry,
my time is very limited. I asked you, the justification given for the move is that the current premises doesn't meet standards, and yet you're saying that the residents will be moving to St. Stephen's and St. Catherine's Ward, which both have dorm-style accommodation, which aren't high standard. So how can you reconcile that as the motivation put forward for the change?
State Deputy, that all of our premises in Cork have problems from an infrastructural perspective. I think that we have infrastructural issues in probably all our centres in Cork, with the exception of our new centre.
I really would appreciate it if you'd answer that question. How do you reconcile the excuse that you gave with the fact that residents will be moving into dorm-style accommodation?
Well, with respect, Deputy, I'm trying to explain to you, I suppose, rather than give you an excuse. That's the first thing to say. The situation, I suppose, in relation to Onacurra is that the Onacurra Centre is closing. The Onacurra Centre is closing for the very serious infrastructural issues that we have.
Sorry, Chair, I'm going to move on to the next question because I've asked that question 3 times. How can you reconcile the excuse that you gave for the closure with the fact that residents will be moving to dorm-style accommodation, which is not high standard?